Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and one of the things that I hear day in and day out from men and women is, hey doc, I hate my neck. And you know, I know what they feel like because I'm starting to hate mine as well. And this video is going to be just a short little primer on what do you do about neck aesthetics, or for fat necks, extra skin, that sort of things. And we'll try and make this brief and give you a quick rundown, because this is one thing that a lot of patients, and unfortunately some doctors, really don't understand. Now, all I do is cosmetic facial surgery, and the only place I do it is from here to here, and I've done over 1,000 facelifts. So I know my way around the face, and I'm so lucky that I get to do this for a living. I mean, I really get excited about coming to work and being with my staff and doing this type of surgery. So here's the deal. Younger patients that have fullness here, frequently that might just be isolated fat. For those patients, the treatment is pretty easy. If there's not excess skin, you can use Kybella, we can do liposuction, and those are the mainstream treatments. Now, you can do some of the machines, the cool sculpting and the thermi and things like that, and I'm not saying they don't work, but I just don't think they're anywhere nearly as effective as going in there and doing liposuction on that fat. So when younger people come into my office, they, if they have isolated fat and not extra skin, they're going to be a patient for Kybella, or more than likely liposuction, because we can actually remove that fat, which is a permanent removal, and we can sculpt not only their neck but their jawline. Some of these patients might have weak chins, and they may benefit from a chin implant as well. Now, the next step up, again, mostly on younger patients, some people just don't have much of a profile. It's just their chin meets their neck. Now, if they have a big old turkey gobbler, they're not a candidate for this. But for younger patients that have fullness in here, maybe a little bit of skin excess, we'll do a procedure called a submentoplasty. We'll make an incision here, and we will do liposuction, and we'll separate the neck skin from the deeper tissue. We'll take the platysma muscle and sew that together in the midline. And again, if they have a deficient chin, we'll put a little chin implant in there. And the submentoplasty is obviously more advanced than liposuction, but nowhere near the amount of surgery as a facelift. So this is a great little procedure, and I'm going to show you some pictures of it and show you a little bit more how we do it. And that's for the selected group of patients that are somewhere between isolated fat and a facelift. Now, no one likes to hear the word facelift, but it's gotten so much easier. 30 years ago, a facelift was 4.5 days in the hospital. Now patients come to my surgery center, and in 4.5 hours, they're back home. So facelift surgery is just much easier, especially in the hands of an experienced surgeon. If you have extra skin here, like I do, and I'm a candidate, if I had some hair, I'd already have a facelift. But if you have extra skin here, you can do all these miracle procedures till the cows come home, and it's really not going to be effective or natural or long-lasting. So if you have skin here and loose jowls, you need this. And there's not a patient or anybody watching this that's over 40 years old that hasn't stood in front of a mirror and done this, okay? So what does a facelift do? We make incisions in front of and behind the ears, and an incision here, and we do liposuction. We reduce the fat. That's called liposculpture. We address the deeper tissues, which are called the SMAS and the platysma, and then we take that extra skin and pull it back, and that's a facelift surgery. So it's so common that people come in here and say, hey doc, I hate my neck, but I don't want a facelift. Well, to do that rundown again, if you're young without extra skin, you have fullness here that is fat, then you may benefit from Kybella injections, liposuction, submentoplasty. If you're an older patient, and for instance, if you have fat and extra skin, and if you liposuction the fat out of there, then you're just going to have more extra skin. And I see that happen. So you go up that scale from liposuction to submentoplasty to your smaller facelifts, like a weekend facelift, which is just a front incision and it's just a smaller tuck for younger patients, to your traditional facelift. And finally, there's another option, which is called the direct excision neck lift. Now, we don't do this very often because it's really just excising this tissue in a method called a Z-plasty. There is a visible scar there, but it's usually an acceptable scar. And we usually do this on older patients that may not be able to do a traditional facelift, and we'll show you some pictures of that. So I hope we have covered the most common ways to affect the submental area, the turkey gobbler, the extra neck skin, because a lot of people hate their neck. If you have extra skin here, you're on the facelift side. If you're younger and you just have fat here, then we can do the smaller procedures. So I hope this helps. We're going to show you some more pictures in a little bit of video. And I'm Dr. Joe Niamtu. LoveThatFace.com. Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and here's the lecture portion of this presentation. Cosmetic surgery is not only my passion, it's my life, and this is a cover of my second edition of my textbook, which has been a bestseller internationally. I'm so proud to have written this book, and also so proud to have won Best Cosmetic Surgeon in the state of Virginia or the city of Richmond 17 times, and I have the greatest staff in the world, and I just love going to work. So we're going to talk about the common options to improve neck aesthetics, and these include fat-dissolving injections, liposuction of the submental and jowl regions, submentoplasty and chin implant, small facelifts, larger facelifts, and finally, direct excision neck lift. So if you're thinking about having fat removed or having a facelift or doing anything to your neck, this will be a valuable presentation for you. The first thing we have to understand when dealing with neck aesthetic is the difference between excess skin and excess fat. The patient on the left and the patient in the middle have excess skin. If you remove fat from these patients, it's actually going to make them worse and not better. So if you have skin, the only way to deal with that is a facelift, especially if it's skin excess of this magnitude. The patient on the far right has more fat excess than skin, and that would be a patient where we would want to go in there and remove that fat. So it's very important to understand that differentiation. Now, there are many ways to do this. I'm not a person that uses machines in my office, and there are things that freeze fat and things that melt fat, and I think that they probably have some merit. And again, I don't have them in my office. I am a surgeon, and my procedures are almost all surgical. But you can freeze fat, you can heat fat, so that does remain an option. Kybella is an injectable that works well for isolated fat without skin excess. It's most commonly used on younger patients in my practice. It's non-surgical, so there's no anesthesia needed. It does require multiple treatment sessions. It does not improve skin laxity. So if you have isolated fat, this may dissolve some of it. If you have fat and skin, all you're going to do is make more skin because it's not going to tighten your skin. The recovery is about 3 to 7 days, and the cost is about $900 per treatment session. Most people need 2 to 3 sessions in my experience. So this is a patient before and after 2 sessions of Kybella. This is another patient. You can see her after her first session, after her second session, and that's about the average improvement I see with my patients for non-surgical fat treatment. Cervicofacial liposuction is one of my favorite procedures. It's a one-time procedure, so you're one and done in that area. It takes about 20 minutes and can be done with local anesthesia or IV anesthesia. It's a permanent result. And when I say permanent result, what I mean is the fat cells are removed and those particular cells don't grow back. You can still get fat in that area with high caloric intake, but those cells are gone forever. You can liposuction the submental area, the front of the neck, that is, the jowls, the sides of the neck, and the jawline. You must wear compressant dressing for about a week and then another week just at night. This improves fat, but does not help gross skin excess, and it's best for isolated fat without skin excess, just like most of these minimally invasive procedures. However, liposuction can cause some tightening of the skin, especially in younger patients, and I'll show you some pictures that show that. The recovery for liposuction is about 7 to 10 days, and the cost is between $900 and $2,200 depending on the areas and the amount of fat. So if you look at these pictures, this is intraoperative pictures of actual patients that I'm performing liposuction, and you can see that nice yellow butter fat coming out of the submental area, and it's not unusual in some patients to have quite a lot of fat removed in this area, which means a very impressive result. This is a before and after of a patient who underwent only liposuction. I did this patient recently. We did no other procedures, and so she not only got some fat reduction, but a little bit of skin tightening, as I mentioned. This is the same patient from another view. So this is a perfect patient for submental liposuction. Here's a patient with virtually no profile, and her chin and her Adam's apple are pretty much in the same plane. So on this patient, I performed liposuction, and I also performed a chin implant. And this is a pretty amazing result for those procedures. Usually, it would require a submentoplasty to get this type of result, and I'll talk about that in a couple minutes. This is the same patient that I just showed from a different view. So that's a home run right there, definitely. Here's another patient, again, liposuction, chin implant, and patients like these with these, what I would call amazing results, these are people that really have a lot of fat and not too much skin excess. And the older we get, it becomes the other way around. We get a lot of skin for sure. Here's another patient, and this is kind of a, this patient had just a little bit of skin laxity and a little bit of fat, and that's before and after liposuction only, no other procedure. So now we're going to move on to submentoplasty. So submentoplasty is changing the shape or the anatomy of the submental region, which is under the chin, above the collarbone. So that's kind of the front of the neck and under the chin. And this involves liposuction, reduction of the deep fat that many people have, platysma plication, where we take the platysma muscle and put it together, and sometimes a chin implant. So this is really sort of a isolated facelift for the neck. It works best in younger patients with poor profile aesthetics, but those that don't have a lot of skin excess. It takes about an hour and is done under IV anesthesia. The recovery is about 7 to 10 days, and the cost is about $4,000 for this procedure. So again, we're removing the subcutaneous fat, and a lot of times there's a deep fat pocket under there, which we will sometimes remove. And then we're taking the platysma muscle, shown in the center picture. We're removing some muscle on each side and bringing it together, much like a shoelace in the center. And what this does is compresses everything in the neck. It also pushes some of the anatomy backwards and upwards and helps define the profile. This is also done in facelift surgery. So here's a patient before and after submentoplasty. That'd be liposuction, platysma plication, and deep fat removal. Same patient. You can see the profile improvement. Here's another patient, a young person, a lot of fat, not a lot of excess skin, just poor hereditary neck aesthetics, and we performed a submentoplasty with liposuction, platysmoplasty, chin implant, and again, you can see how that improves this patient's profile. Now we're going to move into the facelift category, and again, as I said, if you have excess skin, there is no other procedure that's really going to be effective other than a facelift. Now, the weekend facelift is what I call my small facelifts, and I did almost 100 facelifts last year and probably did 3 of these procedures. So it's a small percentage of what I do, and the reason is that it's mainly for people in their 40s that have early aging, which is frequently heredity, and they have some loose skin and some fat, and they don't want to wait till their 5th decade to have a facelift, so we're performing these smaller procedures. So it's younger patients with early jowl and neck changes. It takes about 90 minutes and is performed in my office surgery center like everything else with IV anesthesia. The recovery is about anywhere from 5 days, usually under 10 days for sure, because it's a pretty conservative procedure, and we're frequently not doing a platysmoplasty with this procedure. It's good for jowls, and it's less effective for neck skin excess, and the cost is somewhere between $3,500 and $5,500. So here is a picture of the incisions. You can see that the incisions are in the hairline, hidden in front of the ear, and on the back part of the ear, the incision just goes up about an inch or so. So it's a pretty conservative incision. It's well hidden. Here's what the incisions look like immediately after surgery, closed with dissolvable sutures. Here is the skin excess from this type of facelift. So even on these younger patients, the skin is very elastic, especially with patients with poor genetics, and you can get a lot of skin. You can see the arrow on the right, that's pointing to the bunching skin, and this is one problem with this procedure. If you have a lot of skin on the neck, you're going to get a lot of bunching, so it's inappropriate to do this procedure on somebody that needs a larger lift. Unfortunately, I see a lot of patients, especially when that miracle facelift on TV was being advertised, and I was seeing patients in their 60s and 70s and sometimes 80s who had a small short scar facelift like this, and that is, in my opinion, unethical. This is a patient before and after weekend facelift, and again, this is about the limit of skin or jowl excess that I would use for this procedure, and obviously that's a very nice result. These procedures, they are shorter, they have shorter recovery, but they don't last as long, whereas you can get possibly 10 years or more out of a comprehensive facelift. This is probably in the neighborhood of half of that, but it's important for some patients, and they want this preventative type of facelift. Here's another patient, weekend facelift, and she's shown about 8 weeks after the procedure. I also did a chin implant, which greatly enhances her aesthetics. This is another patient before and after weekend facelift with chin implant. And again, you notice that I use chin implants a lot with many procedures because patients that have a recessive jaw really benefit aesthetically from having a normalized profile. This is another weekend facelift, and if you look at this patient before on the left, you see a little bit of jowling and a little bit of neck skin. So this is a perfect patient for that procedure. I usually tell people with this type of aging to wait 3 or 4 years, but sometimes they just want it done now, and that's what this procedure is for. Now, next we're going to talk about the comprehensive facelift, okay? And this is the big boy. It's the king of all neck and jowl procedures. And for patients that have excess skin, whether it's moderate or major, like a turkey gobbler, this is what they need. Failure to provide this type of procedure is going to have disappointing results. So this takes about 2.5 hours with IV anesthesia. The recovery is about 2 weeks. And this is very comprehensive in that it addresses the neck, the jowls, some regions of the lower cheeks, and slightly helps the nasolabial fold. Now, this procedure doesn't do anything for the upper face, and therefore we're frequently combining other procedures such as brow lift, eyelids, facial implants, or laser skin resurfacing. The cost of this procedure varies from $6,500 to about $9,000 in my practice. Now, a lot of people ask, is this a full facelift? Honestly, that's a really misused term. There really is no such thing as a full facelift. Otherwise, there would be something called a half of a facelift. So when we do a facelift, the old-fashioned lifts, what they used to have is an incision that went from one ear all the way across the top of the head to the other ear, and they did a scalping type brow lift. This is rarely seen. And when we do these procedures now, you have to understand that a facelift is a procedure that basically from the neck to the collarbone and doesn't do anything in the center of the face. So in other words, it's below the nose to the collarbone. That's the area that's improved, and it doesn't do anything to the forehead or the eyes or the nose. So it's important to understand what lift you're getting. These are the typical incisions for a comprehensive facelift, and the blue line in front of the ear opening, that can be placed in front of or behind the little structure there called the tragus, and there are pluses and minuses for doing it either way, and it's very patient or gender specific. The purple areas are the areas that we're undermining. So we'll make the incision around the ear, and with scissors we will undermine, in other words, separate the skin from the deeper tissues, which would be much like a pocket on your shirt or your pants. So we're making two layers out of that region. We're also doing a platysmoplasty like I described earlier, and we're addressing the SMAS. The SMAS is the acronym for the deeper tissues, and it's the superficial musculoaponeurotic system, and it's very important to do something with the SMAS. Depending on the surgeon or the patient, you may do a SMASectomy, a SMAS plication, a SMAS imbrication, a SMAS flap, a deep plane facelift, and it's really less important what procedure that you get and more important who is doing that procedure, because different things work better in the hands of different doctors, and experienced surgeons understand the fact that what works well for them is what they should do. I have performed over 1,000 facelifts, and my preferred technique is generally the skin dissection I have shown you, along with liposuction, platysmoplasty, and SMASectomy. The top picture shows a patient on the operating table with the excess skin pulled back. And again, the skin you're seeing in front of and behind the ear is really the loose skin that was in the neck. In other words, you're pulling this skin to tighten the neck, and we're going to remove this skin. We're going to cut off inches of skin on this particular patient. The picture below is the patient's incisions right after surgery, and these will be amazingly hidden after surgery when the patient heals. Here are two of my patients, and I think this is a relatively typical result. These patients are after facelift surgery, so you can see these patients are about 3 months after facelift surgery, so you can see the excellent aesthetics where it's really hard to even see the incisions. Now, no surgeon can guarantee patients that they'll never see a scar, and once in a while we have a patient that does not heal gracefully, but we can really improve those scars with laser resurfacing. But fortunately, this area heals very well, and if you've done 1,000 facelifts, you should be pretty good at what you're doing. Here are two male patients. The top patient, I used an incision behind the tragus on the inside of the ear, and the bottom patient, I used an incision in front of the tragus, so we did not pull the beard up onto the ear. In any event, you can see that 90 days after surgery, both of these approaches are pretty much imperceptible. So I'm going to show you some before and after pictures of facelift patients, and there's no doubt these are my favorite operations, and I get excited just knowing that I improved these patients, not only their looks, but their sense of well-being. I love being a surgeon and have the ability to do that. This particular patient had a comprehensive facelift with cheek implants. So you can see not only did her neck and jowls improved, but she has cheeks which make her look younger and softer and less mean. Another patient that had facelift, cheek implants, and full face laser resurfacing. Again, as we age, like the left picture, people look hollow and gaunt and tired and sad, and their lower face is square. And by performing a facelift, we give them back that oval face and youthful volume in their cheeks, and by lasering their skin, a nice, new, soft, youthful complexion. The patient I just showed, this is her intraoperative picture, and you can see the amount of skin that will come off during this facelift, which represents the loose skin on the neck and the jowls. Here's a patient that had a comprehensive facelift and cheek implants. This patient lost 110 pounds after gastric surgery and had quite a large comprehensive facelift. She has shown about 8 weeks after her procedure, and obviously we made a big difference in her profile. Here's a patient with just hereditary extra neck skin and jowling. So if you look at this patient's lower face, this is really when you need to do a facelift, and in this case, a larger one. And you can see the before and after picture. We also did her eyelids. Here's a patient with extra skin and a high body mass index, and I've had some of my most dramatic results with patients with this type of body habitus. We did upper and lower eyelids and a comprehensive facelift with mastectomy, platysmoplasty, and liposuction, and that, again, is just a home run result. Another patient, this patient had just about everything that we do. I think she had a brow lift, upper lids, lower lids, cheek implants, chin implant, comprehensive facelift, and laser. So you can literally take decades of aging off some patients when you combine multiple procedures. In the old days, a facelift was 4.5 days in the hospital, and now it's about 4 hours in my outpatient surgery center. And so much has changed with the procedures and the recoveries. In the old days, people used to pull tight skin against a skeletonized face, and you made people look tighter but not younger. We make people look younger because we're restoring volume and doing other procedures to avoid that skeletonized look. Here's a patient with brow lift, upper lids, lower lids, cheek implants, chin implant, comprehensive facelift, and full face laser resurfacing. Males tend to have procedures later in life, in my experience, so it's not uncommon to see males with relatively generous neck skin, and here's a before and after male facelift. Here's another patient in his 7th decade, and a very nice and natural result that really improved this patient's appearance and self-confidence. Now, there's one procedure I want to mention, and we rarely perform this. I might do it twice a year, and this is a direct excision neck lift. And usually this is for older patients that, for whatever reason, maybe not healthy enough to undergo anesthesia. And this procedure literally is a procedure where we're cutting out that turkey gobbler in the front of the neck. We're actually excising that. So most people would just have a regular facelift because there is a visible scar with this, although it blends in pretty well. So this is a very isolated procedure for people that come in and they just grab that piece of skin in their neck and say, "Doc, I've got to get rid of this, but I can't have a facelift for whatever reason." And the cost for this is about $3,500 to $5,500. And again, it's a Z-plasty type incision, and although that looks like a pretty bad incision, it really heals pretty naturally with this configuration. This patient is shown about 5 days after surgery. In my most recent textbook, Dr. Mike Nyack did a chapter for me on this procedure, and here's one of the patients from that chapter. So for the correct patient, this can be an impressive procedure. So we have really, this is a long YouTube video, and I realize that, but I think for people that are trying to make the decision on what to do about their neck, this should be very comprehensive and very helpful. Hi, I'm Dr. Joe Niamtu, cosmeticsurgeryeducation.com, and I hope you enjoy our free YouTube videos. I want to talk to you a little bit about our for-purchase video series, and if you follow our education platform, you know that in the past I had a very successful DVD cosmetic surgery video series that you would order on DVD. To become more contemporary, we've done it all over, and now it is all online. I spent 2 years and recorded over 300 hours of 1080p high definition video, and it's fully narrated in a step-by-step teaching manner. This includes, but not limited to, topics such as blepharoplasty, brow lift, minimally invasive facelift, traditional facelift, facial implants, otoplasty, laser resurfacing, chemical peel, injectable fillers, neurotoxins, mole removal, the management of fat in the head and neck, and other topics. I think this is a great review for experienced surgeons and a great teaching tool for students, interns, residents, or anybody that wants to learn about cosmetic surgery. If you go to cosmeticsurgeryeducation.com, you can preview any video, and they're very reasonably priced. When you order a video, you can stream it 24/7, as well as download it so you own the video. I'm really excited, and I think I put together a really awesome teaching series. Check it out, cosmeticsurgeryeducation.com. I'm Dr. Joe Niamtu.